Hi, I'm Sumit Sandhu.
I'm Kiki.
And I'm Mateen, and we're going to be talking about Retatrutide today.
Hi, everyone. Our group's project focuses on raising awareness about retatrutide. It's a newly approved triple hormone receptor agonist that's being used for weight loss as well as type 2 diabetes. It targets GLP-1, GIP, and glucagon receptors, and clinical trials have shown it may result up to 24% body weight reduction in some patients, which is even more than semaglutide or tirzepatide. With this breakthrough use of retatrutide, it's expected to expand rapidly, especially among younger patients, but reproductive safety is often left out of the conversation.
The problem is that many people of reproductive age are using or considering GLP-1 drugs like retatrutide without being aware of potential risk during pregnancy. Preclinical studies have found that exposure to GLP-1 agonists can lead to fetal growth restrictions, skeletal deformities, and embryo loss in animals. And yet, people are sharing weight loss success stories online without ever mentioning that these drugs can harm a fetus. Patients deserve full information, not just the good news.
Unfortunately, this gap in awareness doesn't just exist online, it's also happening inside clinics. Despite the known risks in animal models and theoretical concerns about GLP-1 agonists during pregnancy, many healthcare providers are not consistently asking about pregnancy status before prescribing these medications. Nor are they always counseling patients on the importance of effective contraception while taking them. A 2024 Canadian review found that even for high-risk populations, such as individuals with obesity-related comorbidities or those using these medications off-label, clear guidelines on conception timing, pregnancy planning, or how to taper and discontinue safely are still lacking. This is especially troubling in a country where 45% of pregnancies are unplanned. That means even if the patient isn't currently trying to conceive, there is a significant chance that the fetal exposure could occur unintentionally, especially during early critical stages of development. Without consistent provider screening and preemptive patient education, we're missing critical opportunities to prevent harm, not out of malice, but simply from a lack of systemized action.
To address this gap, we've designed a public health campaign known as Known Before You Dose. Our goal is simple: make the reproductive risk of retatrutide widely known, both inside and outside of the clinical setting. The campaign includes three different things. The first being a poster and infographic in OB/GYN offices, weight loss clinics, and pharmacies. The next is short videos for TikTok or Instagram with digestible facts that are very quick and easily accessible. The third is a QR code linked resource hub with evidence-based content and provider FAQs. This way, no matter where you are, the clinic or your phone, this information is accessible to you.
Our campaign uses strong, clear messages like, quote, retatrutide changes your body. Make sure it doesn't change your babies, end quote. And also, quote, taking GLP-1s, planning a pregnancy, talk to your doctor first, end quote. We're working with these slogans to reframe patient responsibility as empowerment, not fear. The ultimate goal is to increase contraceptive counseling, support informed decision making, and reduce unintended fetal exposures, especially before post marketing surveillance starts showing real world outcomes.
Although we picked kind of a niche topic, this isn't about just one drug. It's about public health readiness. As more people turn to pharmacological weight loss, safety guidance has to keep pace. There are new peptides coming out every week, and we don't know enough about them to say that they have no negative effects. Our campaign doesn't argue against using retatrutide, it argues for context. If someone is trying to get pregnant, they need alternatives. If they're not, they need to know how to protect themselves. With education campaigns like this one, we can build that bridge between clinical evidence and everyday life. So we're asking everyone, patients, providers, educators, to join us in spreading this message. Know before you dose. Thank you.